On today's episode of Dance Med Spotlight, I get to interview Dr. Marissa Schaeffer. She's a physical therapist in New York, founder of FlySpace Physical Therapy, where they predominantly work with performers, whether it's dance, musical theater, or a lot of other folks in the space, both in the clinic and backstage or on site. In this episode, we talk about what it is to be a physical therapist for performing arts, particularly for those who are considering going into this niche area. We talk about collaboration and building community, whether that is the stage managers, choreographers, studio owners, etc., the dancers themselves, other providers, really who is part of that community and what can that look like. And we talk a lot specifically about backstage and on-site care. To learn more about these topics and more, make sure that you listen to the rest of this episode. Welcome back to another episode of Dance Med Spotlight, where we talk about all things dance medicine and dance science. Today, I am excited to welcome my guest, Dr. Marissa Schaeffer. Welcome.
Hi, thanks for having me.
So, Marissa, my number one question for people joining me is give us a little bit about who you are and what got you involved in the dance space in the way that you are.
Yeah, absolutely. I'll make it brief-ish, but I started as a dancer, as I feel like a lot of us do. And I did have a strong desire to be a professional dancer, and I ended up going to a conservatory just outside of New York City, SUNY Purchase. And I feel like also like many of us, I think pretty early on, I sustained an injury. I had a spondylolisthesis, grade 2-3, and I didn't have someone within the space to help advocate for me, or to help at least help me understand how to advocate for my own body and even ask the questions that were necessary to heal. And as such, I did continue to refracture it with incredible regularity until I was out of school. And I think right before I left school, someone had assigned a project while I was studying abroad, and they said, can you tell us how much dancers make in the United States? And another piece of my education that was missing, I was like, oh my God, I'm not going to make any money.
Mm-hmm.
So I ended up studying to become a personal trainer. So as soon as I graduated school, I started personal training and pursuing dance simultaneously. And that's, I think, personal training and the continuing education that came with that gave me the language to start to understand what was happening in my body. So when I injured myself for the last time, and I allowed myself to kind of feel the symptoms, I was like, okay, something's happening. And I sought care, and things were pretty advanced at that point. And for a number of reasons that I won't go into, I decided, in addition to obviously the injury, that I was going to step away from dancing, but I wasn't done with dancing. But I loved the fact that as a personal trainer, I was giving folks the tools to become stronger and noticing their movement qualities improving. And for myself, it was the first time where I felt like my dance was improving in a meaningful way when I did go to take technique class. And I was like, there's something to this. So I went to the bookstore on 82nd and Broadway, and I bought a book called Healthcare Professions for Dummies. You know, those like yellow books?
Yes, love
And
it.
I got myself a pen, and I went through and I was like, what profession could I pick where I could use my body and like kind of increase, like the ceiling for me as a personal trainer felt a little too low, right?
Mhm.
I was like, how can I kind of use these similar paradigms to increase my knowledge? I want to be autonomous, I know a bunch of things. I also don't want to be in school forever, and I crossed out a lot of things, and physical therapist was still there. So I went back to college again, and I ended up going to PT school. And as I was transitioning into PT school, I was doing a lot of workshops within the dance community already. So pretty shortly after I graduated college, on aspects of health and wellness. I had a traveling workshop that went all around the tri-state area. I went back to my alma mater and taught every year. So I was kind of developing some ideas around how I wanted to approach, working with dancers as a healthcare professional.
Yeah.
And then I went to school, and fast forward, and here we are. and now I work with performers. I mean, I know I just skipped a lot, but I wasn't done. And I think when I graduated school,
Mhm.
I ended up working at Ailey and at Harkness, and I did a brief stint at Physio Arts as a temp, and sampled a lot of spaces until I found out what was right for me.
I love that. And I think exactly to your point, a lot of us have gone through injuries ourselves as dancers and are kind of like, we want something different for the people who are following after us. We might not be able to change a whole heck of a lot for us and our trajectory in the dance world
Yeah.
in that sense. But to offer that to other folks. And I think like one of the pieces that you talked about too is getting work experience in a variety of places really allows you to be informed about what you want your career to look like or your business to look like. I know that's something I utilized for myself as well.
Yeah, absolutely. And it's interesting, right? Like, like many of us, came from a performing arts background. And when I was in grad school, I was like, I'm going to be a performing arts PT. But then I was like, holy mother, there's so many ways you can be a performing arts PT. And there are different cultures and subcultures within different spaces and belief
Mhm.
systems that kind of shape how you can practice the kind of cultural and social norm pressures. And it's crazy again because I was on the other end of that, but I didn't contemplate that going in as a healthcare professional.
Yeah, definitely. So now you are the founder of FlySpace PT. Tell the people a little bit about FlySpace.
So we're almost 4 years old. We are a performing arts physical therapy clinic in Manhattan on the Upper West Side. Um, and we see about 80% performing artists. We see a very high percentage of performing artists. So I said we've been around for almost 4 years. We've had over 40 contracts, which I'm quite proud of, in
Mhm.
both in clinic and on site, dealing with different performing arts companies. In the beginning, it was more modern dance, and we started pivoting towards theater and musical theater. Um, and it's a pretty vibrant space. At the moment, we have 5 physical therapists in the clinic. In the back space, we have someone who rents out and does Pilates sessions. In the front, we have 2 kind of in-house strength and conditioning specialists, one of whom is also a mental performance coach and coaches the crew team up at Columbia, and the other one also has his mental health counseling um, masters. And so we're able to accomplish a lot within the walls of FlySpace, which is pretty brilliant. And it's honestly one of the reasons why I decided to go with the name FlySpace. For those of you who don't know, FlySpace is the space above a proscenium stage where flying set pieces and actors are hung. Right. And so originally I was like, I want to be stage right PT or stage left PT or something evocative of like the stage. But
Yeah.
when someone suggested fly space, I was like, hold on a second, that's brilliant because you in the fly space, you contextually can get so much and you can understand what's going on, right? And so it's not this
Mhm.
myopic view of the knee hurts, let's fix the knee, but the knee in the context of the whole, which includes the body and the choreography and who's in the front leading the space and what's going on with nutrition and sleep and all that mishmash.
Yeah, that's awesome. Well, and it makes me think too, like that's also kind of the space where more of the supportive and behind the scenes magic happens beyond what you just see at face value.
Yeah.
Mhm.
Absolutely. Absolutely.
Mhm.
We like to think of ourselves as the magic sometimes.
Mhm. Absolutely. So let's see. Let's maybe talk a little bit about, first of all, some of the key things that you maybe see come up for performers as far as like health and wellness needs, common injuries. Like, what are some common themes?
Hmm. Um, what are some common themes? I think being overworked and overrun and overwhelmed, all the overs, overused injuries. Um, and then I think having systems that are not supportive as they could be, pardon me, of the individual's health and well being. I think I will start by saying, and I can say this again, that like I'm so grateful to the people who have come before me, who have made having physical therapy or athletic training or whatever, backstage, like kind of commonplace for, not
Mm-hmm.
super, but whatever. Like I can have this conversation, and in Broadway, in certain situations, it's expected, and it's more expected in modern dance. It's more expected in many spaces. And
Yes.
yet we have so far to go. And I think something that I see is that physical therapy or the wellness component gets kind of slapped on top of a system that's already a little overwhelmed.
Mm-hmm.
Um, and it's not quite integrated. So it's like, oh, well, we have a performance coming up and our hours are a little longer than normal and we should get PT in here. But at that point, it's a little late, like we're putting the band-aids on. And so sometimes I think I'm like, what is it that we're doing here? Because in my mind, it's like we have the power not only to make you feel a little better in the moment, hopefully, but also to attempt to keep things from happening, to optimize your movement, to make you more resilient, to give you the education you need to advocate for yourself and for your body. And by the time you've gone through all the rehearsals and tech and previews and you're in performance or whatever, I think our presence uh, is a bit of an afterthought, if that makes
Mm-hmm. Mm-hmm. And I think that's very reflective of just physical therapy in general, where traditionally we've been seen as that very reactive part of healthcare. And we have a problem, we have an injury, we have pain, and now we're getting involved, versus we have so much ability to be in the prevention or reduction side of
sense.
things. I know I was talking with somebody in another episode talking about how even being able to coordinate with choreographers or folks as they're developing a piece or developing a show and going, maybe it's not great that they're doing this particular move 1,000 times. Or what if we balance some of this out a little bit? Like being able to have some of that input and do some of the programming for the performers ahead of time could make such a difference in what their seasons look like and how they progress through their careers.
Yeah, absolutely. And I think, just mentioning back to when I said there's so many different like subcultures within performing arts, I mean, that's going to look so different depending on where you're at. So, for
Mhm.
example, like we are involved with a school in the city, and like over the course of several years, like we started small, right? And we kind of like saw some of the issues that were coming through the door. And at first we were like, okay, so we just started with on-site care. And after the first semester, I said that to the director, I was like, it's interesting, like we have these kind of like welcome letters that say how to use physical therapy, but like folks are not actually using their time effectively. So I think we need like a health literacy course. So we talked to them a little bit about how to utilize time, what kind of information to prepare for the physical therapist so that you can kind of come in and list the things so that we can get to work right away, and then how to talk about their injuries to the teachers and get them to practice that in the space so we're all workshopping together. And now that's working a lot better. So then other issues come up, right? So then we're starting to kind of develop an education system based on this ongoing needs assessment and open dialogue, which is, I understand, for it's luxurious. So for me, having that kind of open dialogue, it's not easy to find, but it is
Mhm.
incredibly effective if done. I mean, and then you mentioned speaking to choreographers and puppetry and set
Mhm.
costumes and all of these things, and observing rehearsals and hearing the people whispering about the things that are causing drama, immediately, and being able to get
Yes.
involved with stage management and choreographers, as you mentioned, and have proactive conversations. And it might not,
Mhm.
I know I'm going on, but like, it might not even be like, I don't know if they can do this, but hey, I just want you to know, like, in our PT sessions, we're starting to see a lot of neck injuries, and people are
Mm.
citing that when they do XYZ in this number, that that's when their neck pain flares. Leave the it there. Do you know what I
Mhm. Mhm.
mean? Yeah. Anyway, it's easy for people, I think, to get a little defensive.
Mhm. And I think that kind of ties into my next question where, either some of the folks involved may feel a little defensive or may feel overwhelmed themselves of like, we don't have time or money or space or whatever to incorporate some of these things that you're recommending or wanting to talk about. How do you have some of those conversations or form some of those collaborations with the folks that are involved, like the choreographers, stage managers, et cetera, to help actually make these things happen for the dancers or performers?
I mean, that's interesting,
That's a
right?
big
I think,
question.
um, again, it depends. And I think sometimes timing is important as well. So having a conversation with production before a production happens. So let's say you go through your first production together, and then you're kind of doing a post-mortem and discussing about the future and just saying like, listen, like we spent X number of dollars on these injuries, putting people in or getting new costumes or, all this kind of stuff. If, and this is something that we could have addressed by having these kinds of conversations, which saves us potentially X number of dollars.
Mhm.
Um, can we think about doing it a little bit differently in the future? Right. So it's like, can you put it in the context of what's going to work for them? I think the other thing, which might not look like, I framed it in terms of money just then,
Mhm.
right? I think that in some cases that's more effective depending on who you're talking to than like, well, they won't get injured. But then some people don't make then the leap of like, and that will save us X number of dollars. Do you know what
Right.
I mean? I
Mhm.
think in terms of, the school setting, like you need to understand the person in front of you, I think, at the end of the day, and what motivates them and how do you put it into context, right? Because a school might not have a lot of money. But if you
Mhm.
say, if you gather enough data to demonstrate that, they're facing a problem for this reason. And in order to get at this reason, these are your four solutions. And if they can if you can frame it in a way that they understand, I think it's a conversation that is, a little bit easier to have, if that makes sense. I
Mhm.
know I didn't quite answer your question. Airplane. Um,
Yeah, and I think exactly to your point of the timing and knowing the person in front of you. It's not the first time you're meeting them and going, "This is everything that you should be doing, and here's the list of what everything's going to cost and what that's gonna look like." Or, sometimes I find that it's giving them tidbits of information over time, and then maybe they get to a point where it starts to kind of come together and it's like, oh, maybe we should kind of take that next step and have something offered on site on a regular basis rather than this single workshop or seminar that you were doing or whatever the case may be. And it a lot of times is kind of that long-term game that we're playing,
yeah,
to build the rapport and relationship and all of that, and get to understand who they are and what they need, um, rather than just coming in and going, I have all the solutions for you.
exactly. Which, like, great, excellent point just then. And I think I was talking to some of my colleagues for a panel that we're doing upcoming. And we also made the point of like, if you, yes, you're playing the long game, like 100%. These contracts develop over time. You shoot for the moon and you land in the stars. But also, if you
Mhm.
shoot for the moon and you land on the moon, like what a gymongous undertaking, because then you have to create it and roll it out in such a way that's like sensitive to the people who are in front of you, which takes a lot of thought and a lot of manpower, and likely you're changing a culture and you have to understand, how they're thinking about health and wellness and all this kind of stuff. It's gymongous. So do you really want to land on the moon the first time? I don't
Right.
know.
Baby steps.
Just baby steps, right?
Definitely. Well, and I think some of this also is making me remember another kind of perhaps more unique aspect of who you are and what you do or your background. You also have an MBA. And so tell us maybe a little bit about how that has influenced what you're doing and your approach to some things.
Yeah, sure. I will, if it's okay, I'll give a little bit of background and context first as to why I
Yeah.
pursued it, because I was definitely like, I'm not going back to school. I have a little business and like a 5-year-old, and I think we're good. But we had just moved into our new, it was new at the time, space that was 2,000 square feet, and it was big, and we'd spent a lot of money on the space. And I was like, oh my Lord, I'm responsible for a lot of individuals. And it's not just the patients that we see on a day to day basis, but it's my employees. And I'm responsible for their health and well being. And if they are healthy and happy and enjoying being in this space, then that's when they're going to do their best work. And I, as a responsible ish human, I had, business advisors and things of this nature. And I was
Mhm.
increasingly more uncomfortable with what I didn't know. And I didn't even have a scope of how far I didn't know where things were. Um,
Mhm.
so I, at that point, toyed with and then the idea of, and then decided to go back to get my master's in business so that I could be more comfortable steering the ship that is FlySpace, because I do want it to go on for some time. And we were gaining and are still gaining momentum. So
Mhm.
um, I did an executive program, and it has been really tremendous for me in all of the ways. I did an executive program, so I didn't have to like stop anything. I didn't have to. I should have perhaps, but I didn't have to. Um, but it was to me, it was so phenomenal to go through each course, whether it was accounting or finance or marketing or economics or whatever it was, and to immediately be able to apply something to the
Mhm.
business, no matter if it's small or large. And we changed a lot of the infrastructure within the business. Um, and it's a way more smooth sailing ship, if that makes sense. And I think, as for myself as a business owner, I feel so much more comfortable at the helm because I have a sense of where my potholes are. They're not in my blind spot, they're like kind of over here. And so I know how to ask for help before I get to it, as opposed to kind of falling into the ditch and then being like, you know. So there's that, and then that confidence and calm has allowed me to then start to build relationships and think bigger picture in terms of strategy and where we want to go,
Mhm.
which is nerve wracking in a different right, but it is enabled for a lot of growth within the business and then up here in the not.
Mhm.
Mhm.
I'm sure going through that process also has helped you just better develop support for the employees that you do have, whether they're in the clinic or they're doing some of the backstage and on-site coverage, and just having things streamlined more appropriately and all of that kind of stuff. What are some things that you think were maybe key aspects of systems that you have in place to support some of those folks, particularly in this realm of performing arts and backstage and that sort of stuff?
Sure. I think I'll give two examples.
Yeah.
Um, see if I can remember them both, because I'm gonna, yeah, anyway, here we go. The first is that, what do we do with our patients, right? We listen. And in listening, we understand where we need to go. I think
Mhm.
one thing that I have noticed as someone who manages people is that my assumptions about others are often quite wrong. And it's really fascinating. Like time and time again, I'm like, oh, they're da 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 da. They must be X, Y, Z. And then I'm like, whoa, mind blown. Absolutely not, out of left field. And so I've created internal systems. Like we have a couple of meeting times throughout the year, but we have more formalized check-ins that have different purposes throughout the year. And one
Mhm.
includes the listening component of like, where do you want to go? Like, how can you help us grow? How, not help, how's not, just kidding, just kidding. That was definitely a slip. How can we help you grow? Um,
Mhm.
and support you and all that kind of stuff? Are there endeavors that you're interested in creating here within this company, et cetera, et cetera? So, um, giving folks a chance to express that so that we can kind of create more internal systems to to support that should it align with, our mission vision at the time. And if not, figuring out
Mhm.
a way to like create space or help them to give them the tools that they need to see that through, if that makes sense.
Yeah.
So, and again, like I said this before, but if people are healthy and happy and feel heard and, et cetera, then that's when they do their best work. So that's what's important to
Yes.
me. I think in terms of the backstage stuff, I know I mean, I always have places to grow, but um, I have made sure that we have standard operating procedures for all of our contracts, save the one where we drop in for a day for an hour, but like anything that's
Mhm.
going for more than a day, which includes who's your point person, what does the welcome letter look like? How do you do something as simple as write a note and search for people, and to what happens in the case of an emergency? Where is the emergency equipment all over the place? Like any
Mhm.
FAQs kind of question you have, it's there. And of course, part of that is for my own mental health and well-being, so I don't get a skillion text messages whenever someone's on site, which is often. But also, again, like if people read that and feel confident coming into the space because they know what to do and what to expect, I think that's great. I think something that
Mhm.
we're toying with, and by we I mean me, toying with as well, is to have regular check-ins
Mm.
regarding contracts. It used to be such that I can kind of be a little bit of everywhere, but we're going to the point where I can't. And so being able to have um, conversations where we have ongoing contracts, where we kind of identify these patterns that are popping up that we might need to address and have larger conversations with company management or artistic direction about, so that, yeah, we have a space to come together and kind of have like a meta conversation as opposed to just be steeped in the day to day, if that makes
Mhm. Mhm. Definitely. And I think when we're talking about working backstage or on site, that looks so different with each production or company or studio or whatever it is that we're talking about. And so having some format to go off of and having expectations of what are we doing service wise, what kinds of supplies do we need, what equipment is available, what space is available is so helpful
yeah.
rather than feeling like you're kind of going in blind every time.
Oh yeah, and I've been in spaces like that myself, and I personally panic, and I know for a fact, because then I hear I
Mhm.
know for a fact I don't do my best work, and they don't feel like I've done my best work either, and it's not a good feeling for anybody, right? For the performer, for myself, for company management or artistic directors who are hearing about the care that was suboptimal. If you don't have access to notes, if you don't know where you're going, if you don't know where the performers come from, it just can get crazy pretty quick.
Mhm. One of the things I really love too is if it's a group that is going to be there for a bit, it's not the one day thing.
Mhm.
If I have an opportunity to learn more about the show, like if like maybe see if I can come in during rehearsals before they actually start performances, or if I'm going to be with them for a while, go see the show early on so then I kind of know what to expect even beyond what the performers themselves are telling me, because knowing what is happening during those times is so informative of what they might be needing without even knowing it would be beneficial to them too.
Yeah, I mean, you totally nailed it. I think two things that come to mind is I was seeing a production and this person kept being like, "Yeah, the moment when I jump off the table, like in all my sessions, the moment when I jump off the table is like the worst. The moment when I jump off the table is the worst." And then I saw the production, and this person was, laying in a position that was really crazy for like a ton of time, and I was like, actually, I feel like that's it. Do you know what I mean? So yeah,
Mhm.
yes, being able to see it and pick up on things that others might not think about. And the other thing that I wanted to mention is I did have the opportunity, which I hope I have more of, to organize physical therapy for a touring group. And
Mhm.
I think, I had heard from a lot of performers on my table who had different therapists in cities that they toured to, that the therapist would be like, yeah, I'm here treating you today, and like, yay, I'm gonna see the show tonight after I treat you, but like, I know you traveled a long way to get there, but it's too late. It's too late at that point. So something that I did, knowing that that seemed to be a recurring issue and was for this particular group when they toured elsewhere, was I was in rehearsals and got permission to film. So
Mm,
I didn't film like a production per se, but I filmed a whole bunch of sequences and then got from the social media team, got certain passages that were necessary and like was up close with apparati with folks trying on equipment. So it ended up being just a short like 8-minute film, but it was necessary for everyone who worked on the production to watch it before, in addition to reading the notes before and having an onboarding call, right, which is also
mhm.
part of supporting the therapist going in so everyone can do their best work.
Most definitely. I think also thinking about the backstage or on-site care,
Mm.
it can, especially if you're somebody just getting started in that space as a provider, it can also be really easy to sort of overdo it. Like, I remember the first time I was covering at a competition, I swear I packed up like half my clinic to take along because it's like, I don't know what I'm going to need. I might need a foam roller. I might need this. I might need who knows what. And, I'm lugging all of this stuff in like 5 trips from the car, just me pulling it all in.
Yeah.
And then it was like, oh, yeah, I maybe needed like 5% of the things that I
Yeah.
brought to note to self. And so it took a lot of refinement over time to kind of figure out, okay, what do I really need? What are some maybe nice to have if I have this space or I can take it with me? And what are the things I really don't need to pack and carry along?
Yeah. Well, it's better to be over prepared than under, I suppose.
Right?
But yeah, that's funny. That's really funny.
For people who are maybe interested in going into performing arts physical therapy,
Mhm.
very early in their career, maybe they're still students, even in training, what are maybe some pieces of advice that you have for them?
Yeah. You have your whole life in front of you. So it doesn't
Mhm,
have to be done right now. I think, and by it doesn't have to be done, I mean, like, you don't have to go into performing arts PT right now. Um, and why do I say that? Not to discourage anyone. I do not want to discourage anyone. We need more performing arts PTs, but like often a lot of the backstage stuff is very fast, 15 minutes, 20 minutes. Right now we're on a 15-minute production. I swear I look like, I don't know, the road runner or like some muppet who's like throwing things all over the place, right? There is an incredibly high level of clinical reasoning that goes into making calls backstage, and I think
mhm,
depending on what genre and what group you're in, the complexity of those calls can kind of vary. But it needs to be top of mind, like you studied for the OCS yesterday,
yep,
because it's not just the clinical reasoning that needs to be there, but it's also you need to have emotional intelligence. You need to be able to synthesize a gazillion factors all at once, collect
mhm,
yourself, separate out the emotion so that you can have really challenging conversations with the people in front of you. And all of that takes a lot of skill and practice. And people, like, again, I keep coming back to this idea of you want to set yourself up for success. Like, you want to go in already with a lot of tools under your belt because, God forbid it doesn't go super well. And then people talk and, whatever. Um,
mhm,
so yeah, I think there's a lot of time to prepare. I can speak for my clinic, like where we are open to having people shadow. Like I would suggest going to shadow. It might not be able to be backstage, but at least you can kind of understand clinical reasoning wise, like how we work within clinic, which is
yeah,
just slower version.
mhm,
But I would say, I mean, for myself, I remember shadowing at several different performing arts clinics in the city. And for me, that was like riveting. And I was like, oh shoot, like what I want to do like is up there. I got to learn all these things in order to get where I need to
mhm.
go. And I like that stuck with me. And so I kind of like pushed me. So yeah, I would say you have time, and I would strongly suggest that you spend some time getting in the reps and honing that clinical reasoning, and then
Mhm.
making a transition when you've had a couple of years under your belt, and then reaching out to have shadowing opportunities or things of that nature.
Mhm. And I think now that there are so many more opportunities, whether it is shadowing or some sort of continuing education or conferences or things like that, versus even, 15 years ago was a totally different story.
Yeah.
So having those opportunities to get some exposure and to build up those skills is so much more available than it used to be, which is amazing.
Yeah. And I think also too, one thing I will say, because I recognize I was like, wait, wait, wait. But also, like, I think as a new graduate, or even as someone who's in school for physical therapy, um, there are a lot of dance studios in this world that don't have care, right?
Mhm.
So I feel very fortunate to have, had the chutzpah to go out and do these like workshops when I was like, 22, 23.
Yeah.
Um, and that really helps you figure out how to talk to the audience and like the people in front of you. It's also, if you're in grad school, go do one for free. People like
Mhm.
free, and again, get some reps that way, which will help inform how you practice and how you speak to performers and things of that nature too.
Yes, for sure. Well, and thinking back to what you were saying before too of, some of the clinical decision making that has to happen, the speed at which some of these things have to happen. These sometimes are circumstances where we are dealing with very acute injuries, maybe an emergent situation. We're having to decide, like, can I handle this? Do we need to send them to urgent care, to the emergency room? Can they continue in the show? Can they continue on the tour? Can they, like, all of these things? And people want to know the answers pretty darn quickly
Yeah.
through all of it. And so having the expertise and clinical reasoning to be able to work through all of it, I think it's a very different kind of circumstance than maybe a lot of our kind of more traditional physical therapy settings in some ways.
Yeah. Yeah. I agree. You got to get some AT skills in there too.
Mhm. Most definitely. One of the things I've also found really helpful, especially when I go do some of these kind of more random on-site coverages, maybe it's a competition that's in town for the weekend or something like that, gathering information beforehand of some of those places like urgent care, emergency rooms, like what is nearby, what is closest, who are some of your contacts or resources in the area, especially if it's not kind of your home spot that you're really familiar with, just so that you have it if in case you need it,
Yeah.
rather than needing it and going, "Oh no, what do I have? I don't know."
Yeah, exactly. Yeah, I think that's something we are so fortunate to have as like a couple of physicians, who we have really great relationships with. So even if we're not
Mhm.
like contracted with them, we'll be like, hey, this company's in town, like they're here for a week. This person has X, Y, and Z going on. Is there any way you can fit them in so the show can go on? Or if their office is closed, we know a couple of places to go to. So
Mhm.
yeah, very
Mhm.
important.
For maybe people who are not as familiar with some of the backstage on-site treatment, is there anything else that you think would be helpful for providers to be aware of if they're finding themselves maybe interested in providing that sort of service?
Let's see. I think having a handful of like quick go-to things, is very helpful. So, for example, there are a handful of like pelvis muscle energy techniques that are
Mhm.
like, someone comes in with like this cluster of like words that they say, and I'm like, boom, ba, 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 right? And it's like,
Mhm.
they're like, oh, wait, it's been like 5 minutes. I'm like, yeah, you still have 15. What else do we need to do? Or like, you can create time. Like, I think I have heard tell and witnessed a lot of, backstage treats that are like massage, 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 but that person's going back on stage in like just a second. Um,
Mhm.
so the more quick techniques that you have, the more that you can kind of refine your fingers so they can listen for when you've unlocked the thing you need to unlock, so that you can then go really quickly into neuromotor re-education, so that they don't feel like, a little wobbly noodle going on stage is going to be super helpful.
Mhm.
Taping techniques also incredibly helpful. I think also too, like, PT is as much an art as it is a science, right? That's evidence-based practice in a
Definitely.
nutshell. It's not just the evidence, it's everything else in front of you. And I think I mentioned that right next to saying taping techniques because your girl only knows a couple taping techniques, but I have a brain, and so being able to kind of refine that based on what the body part is and the costuming is, I think, is important. And so, but it's kind of, you got to get in the flow state where you're like, you're zoned in, but you're also like soft enough focus that you can kind of pull on these creative threads that you need in order to make the treatment work.
Mm-hmm.
Having tape that is different skin tones, kind of ready to go, so that again you can tape someone and they can go on stage without having to go find the latest like pancake situation. I
Mm-hmm.
recently saw someone, I was organizing a weekend of PT coverage for a big production with a whole bunch of PTs in the area, and someone rolled up with the coolest bag ever, which was like a glorified fanny pack that had this little like I don't know if it was a bar or a string where they had strung all of the tape on there and
Mm-hmm.
it was sitting on their hip. And so if someone needed something, they pulled up their handy dandy scissors, which were in a little safety container, and they like pulled out this thing on their hip and they're like, bloop, 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 bloop. Meanwhile, I waste like 30 seconds going over to just go, you
Right.
know, setting up for ergonomic efficiency is great too. I hope
Mm-hmm.
that was a helpful list that was off the dome.
Yeah, yeah, definitely. And I think, one of the things that you mentioned in there that's important too is we're talking about like understanding the show and the performer in front of you and all of that kind of stuff. Part of that is also costuming and like what is coming up for them, making sure that we're preparing them appropriately, that we're not providing something like, say you're doing dry needling for somebody. Is that technique and what you're doing potentially going to make them stiff and sore and they're about to go back out on stage? Or is it something that is supporting them through the rest of the performance? And then maybe we choose to do something else when it's not right in the middle of a show,
Yeah,
and maybe a day off for when they have a little bit of time to recover. What is their costuming like so that if we are taping them or cupping them or something, we don't leave our mark behind for them to go out
right.
on stage with.
Definitely.
Just having some of those considerations for sure.
And as you were saying that, that also brought up something that we have been doing now since the beginning, which is everybody signs a consent and medical screening form, which could include also consent to dry needling or all this kind of stuff, and it also includes a consent, or like they sign a release that says we can communicate with artistic or company management on an as needed basis regarding their health and well-being for the purposes of their safety,
Mhm,
right? So that again, we've set like mutual expectations. Also, like everyone scans that paper before the people walk in the space, or we have it in a notebook, etc. So that we know, because there can be a lot of hidden things within a body you don't know, and you don't have time to actually like suss out. You can't do a full exam.
right.
So important, really important to screen for some of those things before you go in. Also, we have an
Mhm.
open-ended question: is there anything else your PT should know about you and about treatment? Which
Yeah.
may include, hey, when you do a joint mob to my shoulder, it gets flared up and then I can't raise my arm.
Mhm.
Good to know that too.
Mhm.
Okay, I'm totally going to read my favorite little sentence from
Yes.
Tamsin Embleton, pardon me's book on touring and
Mhm.
mental health, which is a tome and is fabulous.
Yes.
And this has like guided me. This tiny sentence has guided me for the last couple of years, which is that individuals cannot maintain resilience if the structures and systems they work within remain dysfunctional. Um,
Mhm.
and that little sentence has like replays on repeat in my head. And I think about it in terms of how I structure my business. I think about it in terms of how I approach conversations with company management and artistic directors, et cetera. I think about it in terms of how I create structures around, again, like backstage care, even if they're like skeletal. Um, and I would also say, and I mentioned this just a second ago, that creating mutual expectations after you have come to consensus on what the heck it is you're going to do, creating a common language and mutual expectations around what it is, and then making sure that everybody can speak the language of what you're doing, meaning this is how we're going to address injury in this school, in this company. These are the procedures we're going to use, and everyone's agreed that this is what we're going to do, right? And so when someone gets an injury and we hand them a report and they go bring it to their teacher doesn't say something disparaging, right? Their teacher understands the system and how it fits into the context of the whole. And then also creating an expectation of like, we are going to all approach this in this one particular way. Again, like getting on the same page, again, helps resilience, right? So
Mhm.
I think that's my parting moment there.
Yes, wonderful. So I think that is a wonderful segue and moment for a special segment on the show. So, in
Yes.
every episode of Dance Med Spotlight, we have the final bow, essentially your take home message. If folks listening to this episode walk away with just one or two tidbits, what do you hope they walk away with?
You all are playing the long game, right? I know we want to break the internet today and like win the lotto, but
If only.
set your sights far out. I think chomping off little bits at a time is healthy for all parties involved because then everyone can digest, right? Um,
Mhm.
what is that called? Mindful eating? I don't know, it doesn't matter. Anyway, but and then also like remember that when you're working with performing artists, like you shouldn't just care about this one person's success. Like you care about the success of yourself, this system that you are within, this system that you've created for that performing artist to thrive in, or what system they have to go back to. Like we have to care for every player on the team in order to make things right, which I understand takes a lot of collaboration and a lot of conversation, and that's why we're playing the long game, you know.
Mhm. Mhm. Yes. Last and certainly not least, the shameless plug. So, this is your opportunity to plug anything that you have going on. You can shout out an organization that you want to shout out, whatever it is, the stage is yours.
Oh my goodness. Okay, I would like to say that what would I like to say? I i am very fortunate, I think, in my life, to have people who are really awesome allies and collaborators. And I don't necessarily mean like we're doing a project together,
Mhm.
but rather they're people who have businesses that are like mine and or somewhat similar, and we can kind of workshop ideas with one another. And specifically, like I'm really trying hard to build community in my backyard, and I'm so touched, I think, by not I think, I know. I am so touched by the community that is being built within New York City around performing arts. I know that in the past we've been relatively siloed, and I believe that we're stronger together. And I'm so excited to kind of see where our relationships take us. And hurrah for physical therapy and healthcare in New York City. That's what I will say first.
Wow.
Um, I think also, let's see, a plug. I think, one thing I celebrate at FlySpace is not just the care that we provide in the clinic. We have a couple of other things that are going on that I feel very excited by. The first is we call it POSH, which is the Performer Open Strength Hour, which twice a week we have low cost open strength training sessions, which are basically like a training room in college, right?
Mhm.
Where we have up to 10 dancers at a time, have semi-private instruction, again, a very low cost with one of our strength and conditioning specialists. And they all get put on an app, and it's not kind of like throw everything at the wall and see what sticks, but really kind of like building folks up and teaching them some basic lifts and principles of progression and things of that nature. And it's been, again, I said community before, I'm going to say it again. It's been a really incredible space to watch community shape,
Mhm.
and to see performers of different genres like become friends. And one of them just told me the other day, like one of them who's in a dance company saw someone who's in Broadway, and like, they have all these selfies celebrating themselves, and they both of them are coming back from injuries and to support each other. And like, that it's so
Yeah.
special. So anyway, if anyone's in New York and wants to build strength in a very loving space, come to FlySpace. We also and the last couple of years have had a bunch of continuing education on site where we bring in people that make me very excited to teach the performing arts community, which is another place where I've learned so much. We've had Tim Gavitt, we've had Emily Sherb, we've had a bunch of folks from UDEL do emergency medical response, and more. I think we've had about 7 courses at this point. And we're just starting to branch out into sharing some of our own physical therapists, like teaching the community as well. So everyone keep a lookout there. I think, again, in celebration of community and celebration of growing together, I think that's what FlySpace is all about. And if you're a performer and you're injured and you're in New York, we take workers' compensation. So come on over.
Mm-hmm. Yeah, wonderful. Well, Marissa, thank you so much for your time today. It was great getting to chat with you and a really great opportunity to talk about some different aspects, whether it's getting background with things like your MBA, creating a community space for the performing arts in your area, and a lot of discussing about the backstage experience too. So thank you so much.
Thanks, Alyssa, for the opportunity. I'm very glad to have been here.
Dance Med Spotlight is hosted and produced by Alyssa Arms. We discuss all things dance medicine. This has been another episode from Dance Med Spotlight. The Dance Med Spotlight is intended for educational purposes only. No clinical decision-making should be based solely on one source. While care is taken to ensure accuracy, factual errors can be present.